under a state of emergency again.
Everyone must stay home to save lives.
The Premier announcing a stay-at-home order, what you can and can't do, beginning tomorrow at midnight. Plus,
we're concerned about overzealous ticketing.
Concerns and confusion over how the rules will be enforced. Experts and citizens weigh in on the government's plan. And
they don't think she's been fed. They know she has not had a bath or a shower in 6 weeks.
The situation in long-term care remains dire, and it's only going to get worse, according to the new COVID-19 projections. Good evening, I'm Kelda Yoon. Ontario is again under a state of emergency with a stay-at-home order coming into effect just over 24 hours from now. That means people will only be allowed to go out for essential trips. All this in an effort to keep the province's healthcare system from collapse. Our Queen's Park reporter Mike Crawley breaks it down for us.
Well, good afternoon.
The Premier gets straight to the point.
Effective immediately, Ontario is declaring a state of emergency.
With COVID-19 threatening to overwhelm the province's intensive care units, Doug Ford's government is imposing an order to stay at home. The exceptions? You can get groceries, see a doctor, go to a pharmacy, exercise, or go to work if it's deemed essential.
I know the stay-at-home order is a drastic measure, one we don't take lightly. Everyone must stay home to save lives.
But no curfew, and Ford admits it wasn't really on the table.
I've never been in favor of a curfew.
Despite the order to stay at home and avoid non-essential trips, non-essential shops are not shut down. They just can't open before 7 a.m. and must close by 8 at night.
When it comes to enforcement, we're allowing more police officers, more bylaw officers to implement fines for bad actors.
For more than a month, much of the GTA and Windsor have been under what the government called lockdown, and yet the COVID numbers just kept rising.
What it shows is that the shutdown was not enough. We need more stringent measures. The data is showing we're in a very dangerous situation now.
The new restrictions will halt some construction work, but there are a lot of exemptions. Residential construction is allowed to continue. Masks become mandatory indoors at all businesses, and outdoor gatherings are now limited to a maximum of 5. The reaction to the restrictions?
They do not go far enough, not even close. I mean, we're facing right now really a complete collapse of the healthcare system in the coming weeks.
The new measures take effect Thursday at 12:01 a.m. They're to last at least 4 weeks. Mike Crawley, CBC News, Toronto.
Many are wondering exactly how the new measures will be enforced, with some concerned the stay-at-home order will further stigmatize groups that are already marginalized. Lorenda Redekop has more.
Quebec, extra officers are out patrolling the streets, ensuring people are abiding by the curfew. Premier Doug Ford says it'll be the same here with the stay-at-home order.
When it comes to enforcement, we're allowing more police officers, more bylaw officers to implement fines for bad actors.
At the end of the day, people have to understand how serious this is and how by staying home, it will in fact save lives. That's at the core of everything we're doing.
But some worry about police and bylaw officers having extra powers and say those repeatedly stopped are often poor, racialized, and Indigenous people.
This is a scary idea that we would have to sort of produce papers to be out walking around in our province. And I think that's not the direction we should be going in.
Some people we spoke to today also have their concerns.
It's a bit too like a military state. You know, we don't want police on the streets not allowing people to go out.
I think it's going to be hard to enforce. In theory, it sounds like a good idea, but we'll see what happens.
I think that police should be fair when considering perspectives and why people are out and about if they have a good reason to.
One question is what it'll mean for those who don't have a home. Advocates for the homeless hope it won't be seen as license for people to call 311 about homeless people.
Before you complain about something, you know, be sure you're not picking on somebody who has a legitimate reason to be outside. And I would hope the message would go out to people who are homeless that there are reasonable exceptions if you simply don't have a place to go to or need to get to a medical appointment.
Despite that, the street pastor agrees with the order, especially given extra worries about more contagious strains.
I do want to say that I think it's the right thing and that we should have done it long ago. We're very...
Officers will also have extra enforcement powers when it comes to people not wearing a mask indoors and also towards retailers who aren't enforcing the new rules. Police in both Toronto and Peel say they're still figuring out exactly what these new orders will mean. Lorenda Redekop, CBC News, Toronto.
If the new measures aren't effective in bringing down the numbers and the UK variant of COVID-19 begins circulating widely in Ontario, this is what officials say we could be facing within weeks. The modeling suggests Ontario could see up to 20,000 new cases each day by mid-February. Hospitals could be overwhelmed before then. Modeling shows ICU occupancy potentially hitting 1,000 beds by early February in a severe but realistic scenario.
Climb closer to 1,000 intensive care beds, about half of our capacity, filled with COVID-19 patients in February. We will have to confront choices that no doctor ever wants to make and no family ever wants to hear. They will be choices about who will get the care they need and who will not. There will be choices about who receives oxygen or is transported to hospital. Decisions we are already seeing being forced on ambulance crews in California, where the virus has spread widely.
Officials say the COVID variant that was first detected in the UK could significantly impact their modeling. So far, there are 14 cases of the variant in Ontario. In the provincial modeling data released today, we also got a glimpse into how we got to this point. Ali Chiasson has more on that.
So we're not seeing any real change in people staying at home.
Charts drawn up from anonymous cell phone data show our mobility hasn't changed much since July, despite there being a second lockdown, the timing of which, Boxing Day, is noted in the data.
You can see that there was a very dramatic spike in retail before the Christmas holidays.
We were also presented with the results of a province-wide survey that asked about our social lives. Are people in your neighborhood physically distancing? 25% said yes all the time, 40% said most of the time, 35% said occasionally or never. In the last 4 weeks, how many people outside of your household visited your house? Only 50% said none. And if so, did you observe restrictions with distancing and masks? 66% said they did. Health officials say these choices are stoking the current infection rate.
There's also a sense that, my group, we're all being safe together.
This Toronto-based psychologist says COVID fatigue is a factor.
Look, everybody's okay here. No one's actively looking sick in front of me, so we must be fine.
And the numbers aren't resonating.
I think we do have a sense of, yes, here are these rules, we're working kind of within those rules, and then we're kind of going to wiggle around some of those rules a bit to kind of, again, fulfill our social needs.
Yes, people are moving around, but that doesn't mean people are going to keggers every day.
Dr. Suman Chakrabarty says, the idea that people just won't listen is an oversimplification of what's going on.
Rather than trying to tell people to stay home harder, we need to, provide people with choices and options.
Most people who can stay home are, but there's a huge number of people who can't because they work essential jobs without essential supports.
Paid sick leave, access to testing within working sites, and also supports for people that need to isolate away from their families, such as in isolation centers. These types of things can target one of the hotspots that we have of transmission, occupational settings in essential workplaces, and that might help to really reduce the numbers that we're seeing.
So will another stay-at-home order make a difference long-term without these supports? The co-chair of Ontario's COVID-19 Advisory Committee says,
I don't believe that it will.
Ali Chiasson, CBC News, Toronto.
One thing many have been calling for over and over again is paid sick leave. So why isn't that part of the new measures? The Premier was asked that repeatedly today. Here's what he had to say.
Well, what we've agreed with the federal government, we aren't going to duplicate areas of support. Well, again, there's the amount that the federal government is given that will get people over the hump for a couple of weeks.
Here is what the federal government covers. It's part of the Canada Recovery Sickness Benefit that provides $450 per week after taxes for up to 2 weeks. You can get that only if you contracted COVID-19 and have lost 50% of your scheduled work, or if you are self-isolating due to COVID-19. The province can legally guarantee paid sick leave and make it automatic with the Employment Standards Act, but that would require the legislature to resume. Right now, MPPs are on a 2-month winter break and aren't expected back at Queen's Park until February 16th. The federal government has secured an additional 20 million doses of the Pfizer-BioNTech vaccine. It's expected to start arriving in April or May. The Prime Minister says that puts Canada on track to have 20 million people vaccinated by June, with everyone who wants the vaccine inoculated by September.
We are very confident in being able to meet the September deadline we've laid out in terms of getting everyone who wants a vaccine vaccinated in Canada. But obviously, if we can do it even quicker than that, that would be great news. The quicker everyone gets vaccinated, the quicker we're going to be able to get back to a semblance of normality.
Canada is now set to receive 80 million doses of the vaccine by the end of this year. The Prime Minister also says deliveries have been scheduled through to the end of February, and all of the provinces now know how much they'll be getting and when. Police officers gathered at Toronto's 52 Division today to mark the 10th anniversary of the death of Sgt Ryan Russell. Russell was killed in the line of duty on January 12, 2011. Today, Greg Ross spoke with his widow.
It's always a tough day, yeah, for sure.
It was 10 years ago today that Christine Russell's husband, Sgt Ryan Russell, was killed while acting in the line of duty for Toronto Police. He was attempting to stop a man who had just stolen a truck equipped with a snowplow. Russell was hit by the truck and suffered serious head injuries. He later died in hospital.
And I tell you, 10 years later, it's still just as significant. It doesn't fade.
Today, several of Russell's former colleagues at 52 Division, including Superintendent Hugh Ferguson, gathered to commemorate the anniversary of his death.
We're here to remember, we're here to honor the memory, and we're here to ensure that, especially the younger officers on the job, don't forget.
It's quite an honor to know that so many people looked up to him and remember him on this day.
While they remembered Sgt Russell, the police officer, Christine Russell remembers the man who was her husband and father of their son.
Well, I knew him as Ryan. I didn't know him as Ryan, the police officer. So he had a great sense of humor. He was just a wonderful person. He loved animals, super friendly. I think greatest joy of his life was having a son. He really, really, really loved spending time with Nolan.
Nolan was just 2 years old when his father died. He recently turned 12. He has no memory of his father, but Christine says Nolan reminds her of his father every day.
100% looks like Ryan.
She says the memories are good these days, but it wasn't always that way, especially having gone through years of court proceedings for the man who was behind the wheel of the truck that killed her husband.
You know, it was tough going through the trial and having a negative outcome, and then all those years of review board hearings, and then learning this July that he was absolutely discharged.
Richard Kashkar was found not criminally responsible for Russell's death. Christine Russell says it was painful, but she's learned to live with it. And it's days like today she's reminded she's not alone.
I really do appreciate all the love and support that I've always received from the police family. Yeah, it's usually
and she says tonight members of that family are going to be joining her for a virtual toast in Ryan's honor.
We all have a little Ryan ginger tonight for him.
Oh, is that right?
Yeah, that was his drink. So
Greg Ross, CBC News, Toronto.
Of a drink wherever everyone is. COVID.
After the break, what today's COVID-19 modeling says about the state of long-term care.
The iron ring that has been talked about by Doug Ford just it's mythical. You know, it does not exist.
Advocates say homes need emergency intervention. That story after the break. Welcome back. COVID-19 projections released today paint a grim picture for what's ahead for long-term care. Residents in care homes already account for most of the deaths during this pandemic. Yet the measures announced by the province don't include any changes for that sector. Lorenda Redekop again with more.
The lack of new measures by this premier is absolutely horrifying.
Surprise from the opposition. That after the modeling projections showed there have been 200 deaths in long-term care since January 1st, with deaths from the second wave steadily rising, likely to exceed those from the spring.
Those are people. They're not just numbers. Those are people. Those are your parents, your grandparents.
The Premier was asked about the so-called iron ring around long-term care and passed that to his health minister.
We are building that iron ring around the long-term care homes by the vaccinations that we're doing. And we have centered our vaccination efforts on vaccinating the residents of long-term care homes, their essential caregivers, and the staff that are coming in.
I was shocked when the minister suggested that now the iron ring is vaccinations.
The iron ring that has been talked about by Doug Ford just it's mythical. You know, it does not exist.
Natalie Mera leads a group that advocates for workers and residents. She just spoke with a PSW from a home in an outbreak.
They do not have access to N95 masks, the PSWs on the floor where the COVID outbreak is. Even some of the workers who are working directly with the COVID positive residents have surgical masks and face shields, that's it. That's the state of infection control in a number of these homes.
This geriatrician says the government not including sick leave will be dangerous to homes and PSWs.
You will not only prevent them from getting sick by tailoring support to them, you'll prevent them, specifically with sick leave, from importing virus into long-term care homes. And so this is a big failure, I think, of today.
Workers, residents, and caregivers in all hot zone homes are scheduled to get their first dose of the vaccine by the end of next week. But long-term care outbreaks are scattered across the province. 40% of homes are now in an outbreak.
The whole concept of priority zones is quickly evaporating, that COVID is everywhere in this province. And so that is leaving tens of thousands of long-term care home residents vulnerable.
As we enter a tougher lockdown, advocates want more supports right away for the people most likely to die from this virus. Lorenda Redekop, CBC News, Toronto.
You're looking at a live shot of the Toronto skyline. A bit of freezing drizzle tonight and mostly cloudy, currently about -1 downtown. Let's go to our meteorologist Colette Kennedy. And Colette, no active weather to worry about just yet.
Thanks, Kelda. You know, still no big storms in our forecast in the near or even somewhat distant future, but we have a little bit of weather in the sense that we've been dealing with some freezing drizzle, so some areas where the roads are still a little bit on the slick side, all around the Golden Horseshoe, also to the north and to the west. So where it's not freezing drizzle, we're seeing some patchy, wet flurries still as well, and that kind of lingers into tomorrow morning. Our temperatures carrying on in the pattern where they've been, which means on the mild side, especially some of these daytime highs where we're getting above freezing and we should be around -2 for a daytime high. Some light precipitation, so there is a system that's coming in, but again, it's not anything big. It's a fairly weak one. That's towards the end of the week where mostly it'll be some rain showers, but some mixed precipitation possible in there as well early in the day and then later when the temperatures are a little bit cooler. Daytime highs today, not exactly cool. I mean, come on, it is mid-January, and we had a high in Oshawa 0, St. Catharines as well, and only a little bit below the freezing mark in other cases, even Kingston, by the way, right up to the freezing mark for a daytime high. A lot of cloud cover, that we know we're contending with, really hard to break through. Maybe a little bit to the north of the GTA occurring through the overnight hours tonight. All that will do is just drop your temperature a little bit cooler through those regions. Otherwise, the southwesterly flow gives us some areas too with a bit of lake effect that we're seeing, and elsewhere it's not necessarily picked up, but that light precipitation that I was mentioning. Through the day Wednesday, there could be the odd sunny break, but really, I think the sun is going to be hard to detect in the sky behind those clouds. Now into Thursday, we should do a little bit better and start to see some sunny breaks. You can see the clouds starting to erode a little bit along the shoreline there, so there's not going to be a ton, but I think we'll have a better chance of getting into a little bit of sunshine there. And I do want to point out, this is late Thursday. It's still back to the west of us, but that'll be the system that's going to be coming in for Friday. A look at your temperatures tonight, a little milder than last night for southwestern Ontario, and definitely milder with the daytime highs. Winds are up to 4, perhaps even 5 degrees for tomorrow afternoon. Tonight, yes, again, still being a little bit cautious on the road. Some of the overpasses or sidewalks where we don't have things necessarily treated could be a little bit slick even into tomorrow morning's commute. By afternoon, highs of 2 to up to 4 degrees. And speaking of those highs, Thursday still 3, but Friday, there it is, 5 degrees. That's why it may be a mix at times, but in many cases turning over to some rain showers there, Kelda.
Thanks so much, Colette.
The weather is brought to you by Trane, the most reliable heating and cooling brand. We test, so it runs. It's hard to stop a train.
After the break, making sure a good dog has good days.
Any hike I go on, Sully was up for it, and he misses that, so now we get to do a little bit of that still.
He may be slowing down, but Sully the dog still gets around in style. More on this adorable pooch after the break. He's a golden retriever who's having a little more trouble getting around in his golden years, but Sully's owner is up for the challenge. Video producer Monty Kruger went along to see how love and determination are making sure a good dog has good days.
Sully isn't able to go for walks as long as he normally does. He just passed 14 and a half. As soon as I leave the house, he wants to come. He just kind of lights up when he gets to go. He loves being outside. We've always gone on big adventures, and when he was younger, and we were hiking and trail running in Yoho and Kananaskis, any hike I go on, Sully was up for it, and he misses that. So now we get to do a little bit of that still. The chariot I borrowed from a friend, and once in a while I borrow a ski attachment, and we go snowshoeing as well. So walks and mountain adventures have been on tap this winter so far. I went through some tough times, as most people do. He was there for me, and he got me through those, just the companionship. He's given so much to me that it's only fair that every second I get it now, I can give that back to him. Yeah, some of the things I've learned, I mean, one obviously is the loyalty. I mean, he's just to a fault. His patience. I mean, when my kids were little, no matter what they did, climb, play with them, he was just there for them, and there's never any concern. I mean, patience is loyalty and love. And he's happy. He just loves life, and he's a people person. So everybody on the trail, he loves to say hi to. He's just got something about him that just people are drawn to.
And that's our show for you tonight. Thank you so much for watching. Dwight Drummond has your next local newscast tomorrow at 6. I will see you back here tomorrow night at 11. Good night.